What I'd really like to start with is an understanding of why advocacy is important. There's a number of current topics that are taking place right now that really need nursing to kind of be at the forefront. Gun violence, the opioid epidemic, workplace violence, a lot of funding that's happening right now related to nursing workforce development and funding for National Institute of Nursing Research, and many issues related to advanced practice nursing, scope of practice, et cetera. So advocacy is really important. And because, it's something that had been really on my heart, one of the questions that I had was, well, how much do I really know about advocacy, right? I teach in nursing school, and to be honest, most of our content is NCLEX driven, right? We're not really teaching about I teach leadership and I include a little bit about it, but for the most part, we're not really schooled on it, right? And then the other aspect of it was that, advocacy sometimes seems very overwhelming, and I don't have legislative background. I don't understand the verbiage that these people use in, Washington, D.C., or it's just too intimidating for me. So what I wanted to do was kind of get an understanding of where we as an organization stand in our understanding. So last year at the AAACN conference in Nevada, I came up to the podium and just did a pitch, right? To those that had come to attend the legislative session. And I said, hey, here's something I'm interested in, would you be interested in knowing? So the attendees that came there did a self-assessment. It was a quick, code that they went in and did a self-assessment to really see where they were. And so today I'm gonna share, I've sort of set up the presentation in two ways. We're gonna talk collectively about what our strengths are, right? What do we do well? What do we know? What do we have a good handle on? Then we're gonna talk about some areas where we're making progress. We've sort of gotten to this place where, for the most part, we're kind of 50-50. And then the last few slides, we're gonna talk about the key areas where we need a lot of improvement. So my suggestion today, if you have a pen, or your laptop in front of you, take a couple of notes to see, if I were to answer this question, how would I answer it? And do I know it? And if you don't, that'd sort of be your homework when you get home to say, well, I'd like to get more involved. How could I do that? And you yourselves have already created a list. Does that make sense? Fabulous. So the descriptive research study was to explore nurses' level of political awareness. My hypothesis was that nurses typically do not think of public policy as a component of their role as a nurse. So strengths. What did the research show for the population? We got that over 80% voted in the past election. They stayed aware of current health issues. Nurses said they belong to a professional organization, and that they were more interested in political issues now than they were before. So that was a good area of strength. In terms of good progress, 66% said, I recognize the names of the majority of candidates on the ballot, and I'm acquainted with the majority of the issues in the last election. 65% said, I look at the literature my state nursing organization or professional magazines are telling me about healthcare issues, right? And I know the names of senators and representatives. That was at 64%. So I think that was those are the areas that we're doing pretty well in. Where we're 50-50, only 50, we ranked that we didn't know names of congresspeople in Washington. So, that was kind of something that was a bit surprising, but, maybe it's not something that and all it takes is a real quick Google search to find that information out. how a bill is introduced in state legislature. And when we were prepping for this, one of the things that came to mind was, I don't know if anyone knows Schoolhouse Rock, like how a bill becomes a law, right? That's how I learned it, right? Like, so there's lots of clips of things that you can look at to kind of figure out how it comes. And for those of you who don't, just search Schoolhouse Rock, how a bill becomes, it's adorable. Okay. 50-50, I know at least 2 issues that are currently under discussion at the state or national level. Okay, and now here are the growth areas, right? So these are the areas that we really need to kind of up our game and figure out how we can get to know. I attended the past state or national convention held by my organization. So for those of you who are here and those of you who are virtual, we're kind of getting there with that, right? I'm aware of the composition of the board that regulates my practice, right? So different boards of nursing are set up differently. Do we know how it is in the states that we live in? I know which Senate and House committees usually deal with health-related issues. I have written, whether hard copy or email, to one of my state or national representatives in the past year related to a health issue. Meeting with your representatives is a great opportunity, but something as simple as sending an email is a great way to kind of get connected. For those of you who have social media, all the offices have opportunities for you to connect with them and let them know where you stand, right? Like we're such a large segment of the healthcare population, and although our representatives might be experts in lots of different areas, we're the experts in nursing, and really that's the most important part. 21%, I know a member of a health board or advisory group to a healthcare organization or agency. At 18%, if my professional organization had a lobbyist, I know how to contact them. At 18% again, I know the process whereby one becomes a member of the state board. And the last thing is about the lowest percentages that we had is I contribute financially to my state and national professional organizations PAC. I think this is something very important for us to kind of support our political action committees in our states. I'm personally acquainted with a senator or representative or a member of his or her staff. We're at 9%. I attend public hearings related to health issues at 7%, and serving as a resource person for one of my representatives and his or her staff is at 4%. So again, like I'd mentioned, this was a self-assessment for each individual person. And in terms of the collective data that, just sort of to give you context, there was 213 nurses who conducted this survey. The scoring is over, it's in ranges. So those that scored 0 to 5 are totally unaware politically. 6 to 11, slightly more aware of the implications of politics and nursing. 12 to 16, beginning political communication astuteness, and 17 to 21, politically astute. Now, we're not going to 0 to 21, but just to kind of keep in mind as you guys went through it and started to document stuff, you sort of get an idea of where you stand with that, with the questions that we had. And the goal is to just get a little bit more, right? Like, it's not like you're going to quit your job and run for office, although that's not a bad idea. But I mean, the goal is to just get a little bit more acquainted, kind of, like we heard earlier today, step out of that comfort zone that we have, to be bold, to be comfortable in that uncomfortable.